Hello and welcome to our Handling Information in Care training course. Before we begin, let me ask you a question. Suppose you shared a piece of personal information with someone and that person was unable to retain it, and that's how it got misused. How would that make you feel? We get it, and we also get that you don't want to end up like that person. That's why we are here to guide you through the critical aspects of handling information, especially in care settings. So stay with us because we're about to dive into everything you need to know.
Let's begin by knowing if UK legislation has anything to do with this matter. The UK legislation ensures that caregivers are accountable for handling the personal information of service users in their charge. This includes specific aspects of gathering, recording, storing, and sharing that data. Whilst caregivers cannot be expected to have expert knowledge about IT storage software, hardware, or physical indexing methods, they are expected to raise any concerns or problems that they have when handling personal information. But to do this, they must have an awareness of their responsibilities. There are several approaches to gaining awareness of their responsibilities and finding other forms of guidance for information handling. In most cases, this will involve a discussion with a direct line manager or a senior figure. On some occasions, it may mean contacting the Information Commissioner's Office, ICO, a public body that is sponsored by the Department for Digital Culture, Media and Sport. They can provide details about UK legislation and answers to other questions that may arise about information handling. Due to the personal nature of the information that caregivers routinely handle, they must be confident and proficient in their handling techniques. They must also be able to know how to access training and support when it's needed for information handling. Now, let's explore where we can get advice and guidance on information handling. For caregivers, the primary account of knowledge needed for information usage can be categorised into three areas. 1. Care workers and residential care home staff. 2. Personal carers and domiciliary care workers. And 3. Activities workers and nursing home staff. When handling information and data in a care setting, all professionals must ensure that it is safeguarded and dealt with in a manner that aligns with UK laws and regulations and meets the standards needed to ensure high levels of service and care. This means that all information must be recorded accurately and containing up-to-date details that allow professionals and practitioners to meet the total needs of service users. Stored securely and safely so that personal details and private data can retain confidentiality and meet public standards of administration. Be available for reference to the appropriate professionals and practitioners whilst respecting an individual's right to privacy and adhering to agreements as to who can access it.
It's critical that caregivers are fully aware of the legislation that covers data and information use and strictly adhere to the restrictions and guidelines while still carrying out essential duties and responsibilities. These legislations are Data Protection Act 1998, General Data Protection Regulation GDPR 2018, Human Rights Act 1998, Freedom of Information Act 2000, Care Act 2014, Health and Social Care Act 2008, Regulated Activities Regulations 2014. You will find the details of these legislations in the resource section of this course. Let's find out why it's important to have secure systems for recording, storing, and sharing information. Secure systems are crucial for safe information storage and compliance with UK legislation, and poor recording can lead to mistakes, confusion, and unsafe practices. Breaching confidentiality or sharing information without permission can occur in rare cases due to emergencies or mitigating circumstances. Nobody wants that. That's why we will share some points that can help with this.
Caregivers should handle personal information with compassion, sensitivity, and empathy, ensuring trust and openness. Information sharing should only occur with permission and in line with confidentiality agreements and legal restrictions. Decisions about personal information sharing should consider the service user's needs, preferences, and conditions, and consider issues around mental capacity and reasoning.
Now, how to secure different types of information. There are physical documents and paper-based files as well as digital files.
For physical documents and paper-based files, a few methods can be used. For example, physically lock away paper records and personal documents, ensuring keys and combinations are tightly controlled and never compromised. Keep physical records in good condition, safeguarded from damage by elements and theft, using waterproof, fireproof, and theft-proof receptacles. Maintain records in a manner that enables quick and efficient retrieval when necessary, employing indexing systems and potentially IT applications for support. Ensure important documents have contingency plans, such as duplicate hard copies in secure locations or electronic copies stored online. Clearly mark and maintain files and documents for easy identification by authorized individuals, including neat handwriting and readable supplementary notes. Regularly review storage systems for strengths and weaknesses, inviting feedback from colleagues and users to ensure security and accessibility meet requirements, especially during critical deadlines. On the other hand, for digital files and IT hardware, all recorded data should be password protected, firewall protected, malware protected, and have a backup. But what happens when the information is not stored effectively? If the system adopted by a caregiving organisation to safeguard information is not fit for purpose, it means that resident caregivers must take accountability for upholding the lawful and ethical considerations for confidential data. They must also be prepared to handle the consequences if this is not performed effectively. Let's see what consequences can occur. If a service user has had their privacy compromised and data shared, this will cause them to lose trust in their caregiver to a significant degree. It can lead to private information falling into criminal hands or being used for malicious intent. If the data becomes permanently lost, it could lead to severe consequences. Let's look at Dr. Sam to better understand the importance of effective information storage. In a busy hospital, Dr. Sam rushed to help a patient who had been hurt in a car crash. He needed to know about their medical history, but couldn't find all the information. He tried to call the patient's family, but their phone numbers were old. Dr. Sam felt worried. Time was running out. After trying hard, he found some details, but it took a long time. It is not appropriate to treat the patient without analysing all the relevant information. This time, the patient got lucky, but luck doesn't always come to the rescue. That's why it's absolutely vital for all of us to prioritise maintaining a robust information storage system. Mastering an information storage system means that professionals and colleagues can instantly reference essential details, and essential needs can be satisfied immediately.
Anyway, moving on to our next segment, record keeping. It's an essential concept of information handling.
The principles of good record keeping are that one needs to be factual, consistent, and accurate. Be updated as soon as possible after any recordable event. Provide current information on the care and condition of the patient. Be documented clearly in such a way that the text cannot be erased.
Maintaining up-to-date, complete, accurate, and legible records is crucial in health and social care settings to ensure that an individual's care plan reflects their needs.
This includes information about the individual's senses, communication, lifestyle, safety, personal hygiene, eating and drinking preferences, breathing and circulation problems, mental health, and future decisions. But what can we do to keep records that are up-to-date, complete, accurate, and readable? To keep records that are up-to-date, complete, accurate, and readable, one must write them correctly so that others can understand them, ensuring proper handwriting. Ensure the security of access to records and reports according to legal and organizational procedures, ethical codes, or professional standards. Work in partnership with the individual in a person-centered approach. Ensure the individual's care plan is reflecting on the individual's care needs.
We're very close to the end of this course. Before concluding, let's focus on how and whom to report if agreed ways of working are not followed. Let's delve into the essential steps and key individuals involved in ensuring adherence to established protocols and procedures.
The rules and regulations about correctly handling personal information, both from an organizational perspective and a legal one, are very important in the role of a caregiver. However, they must also know how to react when concerns are raised over the ways in which it is taken, stored, or used. On some occasions, the appropriate response may not be as apparent as it may seem initially. All care settings will have working policies and procedures in place that detail the appropriate actions to be taken when someone raises concerns over information handling. When working in an organisation or for a specific employer, a caregiver is duty-bound to be aware of these guidelines and ensure that they adhere to them. These will note what details need to be known about the concern, who needs to be told about them, and how they must be documented. Staff may have concerns about routines, and they are ethically and legally obliged to take action if the correct protocol is not always followed. Whenever serious concerns or queries arise regarding personal information handling, a caregiver should ensure that they follow specific steps, evaluating the progress and situation. If the concerns are not appropriately acted upon, they should be escalated to someone more senior in the organisation. This can be done verbally or by official written communication. Caregivers also have the duty and right to report work-related concerns to the Care Quality Commission, CQC. Taking steps to report an employer or an organisation to regulatory bodies can be intimidating and daunting, but it is the correct action to take if they do not respond to legitimate concerns and are legally supported. There are simple do's and don'ts that can be memorised when acting on concerns regarding information handling. The most important ones are do's and don'ts when dealing with concerns. Do's. Record all concerns you have or that are raised with you. Report all concerns you have or that are raised with you. Listen to and treat all concerns seriously. Take action immediately when you have concerns or when these are raised with you. Don'ts. Ignore concerns you have or that are raised with you. Forget or be afraid to report all concerns you have or that are raised with you. Make judgments about the concerns you have or that are raised with you. Delay or do nothing when you have concerns or when these are raised with you.
And that brings us to the end of this course. Thank you for staying with us. We trust you've learned a lot from this course and will be able to handle information appropriately afterwards. Please check out the resource section to learn more. Goodbye.